What subtle symptoms point to rare genetic conditions? Imagine noticing small changes in a child's behavior or body that seem minor at first. These tiny clues can actually point to rare genetic conditions. Sometimes they show up as developmental delays. A child might not sit up, crawl, walk, or talk at the usual ages. Or they could lose skills they once had, like speaking or using their hands normally. If this happens after a period of normal growth, it can be a warning sign. Mild learning difficulties are another subtle sign. A child might struggle with schoolwork or have trouble understanding instructions. They may take longer to solve problems or reason through things. These issues are often mistaken for being a late bloomer or behavioral problems. But when combined with other signs, they can hint at an underlying genetic issue. Physical features can also be clues. Some children have a smaller head size, called microcephaly. Others might have a triangular face or differences in body proportions, like one side being larger than the other. Some may have pits or creases in their earlobes, an enlarged tongue, or skin that looks different in texture or color. These small physical signs can be easy to overlook but are important. Behavioral changes are another subtle indicator. A child might become more irritable, withdrawn, or show repetitive movements like hand-wringing or tapping. These behaviors can be mistaken for autism or other neurodevelopmental disorders. But they could also be linked to rare genetic conditions. Other signs include unexplained seizures, muscle weakness or stiffness, balance problems, or breathing difficulties. Some children have trouble feeding, low blood sugar, or difficulty gaining weight even when eating well. These symptoms can be mild at first but are important warning signs if they persist. Many of these symptoms can also be caused by common conditions. But when several of these signs appear together, or if there is a family history of genetic disorders, it might be time to consider genetic testing. Early testing can help families get the right support and care. In short, subtle signs like developmental delays, mild learning difficulties, physical features, behavioral changes, and physical problems can all be early clues. If you notice these signs in a child, talking to a healthcare provider about genetic testing is a good step. Recognizing these small signs early can make a big difference in managing health and planning for the future.